I'm Dr. Linda Gromko, and this is Transgender Medicine Made Simple. Today we're looking at a question of the week, and that question is, do I have to stay on testosterone forever? This question was brought up by a transmasculine individual. In his case, he had been on testosterone to treat gender dysphoria for approximately 10 years. He was happy with the changes that were brought about by testosterone. For example, a lower voice, facial hair, and changes in his body and appearance. He had had a hysterectomy, so he wouldn't have to worry about periods or pregnancy concerns. But he was tired of taking testosterone injections, which is not uncommon. So let's take a look at this in 3 simple points. Point number 1, everybody has both estrogen and testosterone in their bodies. It's normal for sex hormone levels to increase when a person reaches puberty, to level out through our adult years, and decrease as a person ages. And this applies to everybody, regardless of gender or gender identity. Point number 2, with testosterone, the voice drop and the body and facial hair growth are permanent changes, but menstrual periods do come back when testosterone is stopped. Now, of course, this was not an issue for our patient because he had had a hysterectomy, but with the uterus and ovaries, of course, fertility issues and birth control issues return. Point number 3, without adequate sex hormones, a person's bone health may suffer, and a person can develop bone thinning. When it's at its most severe, this is called osteoporosis, and osteoporosis can lead to broken bones. People who are assigned female at birth start out with less sturdy bones or less bone density than people who are assigned male at birth. So particularly in AFAB individuals, it is reasonable to get a DEXA scan to evaluate a person's bone density. Bone health can be protected by adequate vitamin D and calcium, weight-bearing activity, and in some cases, medications. So in response to our patient's question of the week, no, he doesn't have to stay on testosterone forever, particularly because he has had the permanent changes that he wants to see. But it is reasonable to assess bone health markers like a DEXA scan as a person makes this decision. And it's helpful to explore if another route of testosterone, for example, a testosterone gel or cream, might be acceptable, or if less frequent injections might be more tolerable to the patient. So I hope this information is helpful for you today. If so, please like this video and do subscribe to my channel, Transgender Medicine Made Simple. Thanks for watching, and I'll see you in the next video.